Hello everyone, my name is Benjamin Steinbacher. I'm a student at Liberty University, and for this assignment in my Capstone in Psychology course, I interviewed a professional in the mental health industry to get a better understanding of what working in this field is actually like. I had the opportunity to sit down and talk to someone named Thomas, and his experience offers a unique and valuable perspective that goes beyond what we can learn from just a textbook. In this video, I'll talk about our conversation and discuss what he does, what he finds most rewarding, and the challenging aspects of his job there as well, and his advice for students like me. Throughout, I'll be adding my own reflections on how his real world experiences connect to the concepts we study. So first I asked Thomas for his name, job title, and the degree required for his role. His name's Thomas, and he's a TMS technician. The first thing that stood out to me was when he said that his position doesn't require a specific degree. This was an important realization for me, suggesting that there are accessible and impactful entry points into this field. And for a student like me, a role like this could be a perfect way to gain hands-on experience and to confirm if this is the right career path before committing to years of graduate school. It's like a test drive for a career in mental health, and I'm currently looking for a job like this just to get me into the field. TMS, or transcranial magnetic stimulation, is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain, primarily to improve symptoms of major depression. As a technician, Thomas's role was multifaceted. He listed duties like being the first point of contact, handling scheduling, communicating treatment plans, and helping patients set up and follow goals. So thinking about those duties, their importance really stands out to me. Being the first point of contact means that he sets the entire tone for a patient's clinical experience, which can be a critical way for someone who may be coming into this being really anxious. When he talks about coordinating with the psychiatrist's schedule and communicating the treatment plan, I think this highlights how collaborative modern healthcare is. He's a key part of a larger team, ensuring the patient's journey is both smooth and understood. This leads directly into what Thomas finds most fulfilling. He said that he enjoys the relationship aspect with the patients, just building relationships. In our classes, we often talk about the importance of the therapeutic alliance, usually in the context of psychotherapy. What Thomas' experience shows is that this concept isn't just limited to a therapist's office. He explained that because he sees the same patients week after week, that consistency becomes a therapeutic tool in itself. For a patient whose inner world might feel chaotic and unpredictable, having that consistent, calm, and supportive professional to see at every visit can be incredibly grounding for them. It builds a foundation of trust that allows medical treatment to be more effective. And that's one of the key things that I learned from this interview. And next, I asked Thomas what he finds challenging, and his answer was the part of the interview that made me think the most. He said that the job gets difficult when patients aren't truly interested in making the necessary changes required for growth. He described a key difference. Many people want to feel better about their current situation rather than committing to changing the destructive habits that created the situation in the first place. This leads to frustration when the treatment doesn't work. This was a significant insight for me. It pulls back the curtain on the reality of this work. Healing is not something that is done to a person. It's a process that they must actively participate in to achieve any kind of results. This also makes me consider the emotional toll on the provider. It must be pretty challenging to see the potential for a patient to get better and have the tools and technology right there, but to be held back by a patient's readiness to change. It's a great reminder that this work requires immense patience and an understanding of the complex nature of human motivation. And I think that's something that is really hard to learn unless you have hands-on experience with people. When I asked about his plans for professional growth, he told me he's in school studying to become a licensed marriage and family therapist. This makes perfect sense given his passion for the relational side of his work. He's taking what he loves most about his current job and building a career path that allows him to practice it at an even deeper and more impactful level. And having working with him at a job in the past, I can 100% say that he very much enjoys the relational aspect of work, no matter what job it is. And finally, his recommendations were very practical. He highly recommended becoming a TMS technician or working in behavioral health, as these roles are built on consistency and goal setting. His final thought to me was that without working towards goals, there's no true healing. Reflecting on that, it's about giving patients a sense of agency. Setting and achieving small goals moves a person from being a passive recipient of care to being an active participant in their own recovery, which is the entire point of the healing process, and doesn't really make sense to continue if you don't have that participation element of it. So to conclude, this interview taught me several things. First, it taught me that the field is more accessible than I thought, and having vital roles that allow for real experience before pursuing an advanced degree. Second, I learned that a strong, consistent human connection, a therapeutic alliance, as we read about it a lot in our courses, it's the foundation upon which even the most advanced medical treatments are made more effective. And finally, I gained a much more deeper appreciation for the reality of motivating patients. I now better understand the distinction between wanting symptom relief and being ready for fundamental change. And this is something that I had no awareness of previously, and could really only learn that by talking to someone in the mental health field. This interview provided a realistic, grounding perspective that I'll definitely be carrying with me throughout my studies and into my future career in the field of psychology and mental health. Thank you.